The UK's National Health Service just ordered every single one of its public GitHub repositories set to private. The reason? An AI model got too good at reading code. The deadline is May 11th, 4 days from now. Every public repo goes dark, and 682 people, including a former UK health secretary, just signed an open letter saying this is a catastrophic mistake. For context, NHS England is the largest employer in Europe, 1.5 million staff, 56 million patients. It runs one of the biggest healthcare IT infrastructures on the planet, and for years, it published its code openly on GitHub. The NHS had a long-standing policy, open by default. If public money paid for the code, the public should see the code. It was a transparency play. Hundreds of repos, authentication services, patient-facing apps, internal tools, all public. And now, a complete 180. NHS England is reversing that policy. The official rationale? AI models. Specifically, models like Anthropic's Mythos can ingest entire code bases at scale and find vulnerabilities that human reviewers would miss. Mythos is Anthropic's most advanced AI model, 1 million token context window. It can read an entire codebase in one pass and identify security flaws, buffer overflows, auth bypasses, injection points, faster than any human security team. The NHS security team's nightmare goes like this. Public repo. AI ingests the code, finds a vulnerability in the patient record system, exploits it before anyone patches. Now your medical history is on a dark web marketplace. But 682 people disagree. The open letter includes Matt Hancock, the former UK health secretary who pushed for digital health during COVID. He called this a, quote, huge mistake. Hancock's argument is simple. Open source code gets more eyes on it, more security researchers testing it, more bug reports, more patches. Hiding the code doesn't make it safer. It just means fewer people can find the bugs before attackers do. And then there's Terence Eden, the former head of open technology at NHS. His response was devastating. Quote, all this code was already ingested for training years ago. Every major AI model was trained on public GitHub data. The horse left the barn in 2021. What NHS England is proposing has a name in security. It's called security through obscurity, and it's been considered a bad practice since the 1980s. Hiding the code doesn't fix the bugs. It just means you find out about them when they get exploited. There's a principle in open source called Linus's law. Given enough eyeballs, all bugs are shallow. More reviewers means more bugs caught early. Close the code and you don't have fewer bugs. You have fewer defenders. Here's the thing the NHS isn't saying. AI-powered code analysis works for defenders too. Mythos can find vulnerabilities, but so can your own security team using the same tools. Taking the code private doesn't stop attackers. It stops defenders. The data backs this up. Open source vulnerabilities get patched in a median of 30 days because the community spots them and submits fixes. Closed source? 90 days or more, sometimes years, because you're relying on one internal team. Cory Doctorow, the author and digital rights activist, also signed the protest letter. When the EFF's most prominent voice on digital freedom says you're making a mistake, you're probably making a mistake. But here's what makes this story bigger than the NHS. If Britain's largest public institution closes its code because of AI, who's next? Every government agency on GitHub is looking at this and asking the same question. This could trigger a wave. EU agencies already nervous about AI compliance, US government repos under review. And if major institutions pull their code off GitHub, the open source ecosystem loses contributors, testers, and trust. There's a better path. Bug bounty programs, AI-powered automated scanning on your own repos, responsible disclosure policies, dependency audits. These are the tools that actually improve security. Hiding the code is not on that list. The timing is fascinating. The order dropped May 5th. The protest letter hit 682 signatures in 48 hours. The deadline is May 11th, 4 days. The question is whether the backlash is loud enough to force a reversal. But forget the NHS for a second. The deeper question is this. If AI models can ingest and analyze every public repository on GitHub, does that change the calculus on open source itself? Is the entire model broken now? No. Open source has survived proprietary FUD campaigns, Oracle lawsuits, the Heartbleed panic, and the Log4j crisis. Every time, the response was more transparency, not less. AI reading your code is not a reason to hide. It's a reason to write better code. May 11th is 4 days away. Either the NHS follows through and sets a global precedent for AI-driven code hiding, or the protest wins and open source gets its biggest public defense since Heartbleed. Either way, this story isn't over. The NHS thinks hiding code from AI will keep patients safe. 682 people think it'll do the opposite. Subscribe so you don't miss what happens on May 11th.